This course is going to be a review for urology, and those that are interested in taking certification, you might ask yourself as we're going through this at kind of a whirlwind pace, is this something I know or something I need to look into more? So let's get digging right into it right now. Albert Einstein had this nice quote, if you can't explain it simply, you don't understand it well enough. So if you guys don't get this, it's because I don't know what I'm talking about. So we're going to talk about obstruction, trauma, and stones, all in 60 minutes or less. So the obstructive uropathies are listed here. We're going to start with congenital. So this is the stuff that you're born with. So the most common cause of chronic kidney disease in children is obstructive uropathy. The largest prevalence of this is the ureteral pelvic junction obstruction. And since most of the children things are done in ultrasounds, we can see here's kind of a normal kidney, and this is a hydronephrotic. We see those big pockets. Water looks black on ultrasound versus tissue. So, it's about 1 out of every 1 to 2,000 births. It's more a male 3 to 1 predominance, and it can be bilateral. And it usually arises from an adynamic portion of the ureter. And if we look at this picture here, we can see that, this is our normal size. As we look at this kidney, we can see that that little bit of narrowing right there, what they feel is that most likely the ureter is not constricting. It's not squeezing urine down, and that's why they developed this blockage there. So the next place is, and we go from all the way from the top of the kidney down to the bladder, which is our ureteral vesicle junction obstruction. So urine flow is restricted close to where the ureter inserts inside the bladder. It's the second most common form of congenital obstruction and 4 times more common in males. And again, as we look at our ultrasound, that's the bladder filled with water, with urine. And there's our right ureter. We can see how big that is. And then all the way up, as we look at our picture here, our normal system, as we look all the way up, we can see the dilation of that ureter all the way into the kidney. So ureteral vesicle junction obstruction. Ureteroceles are cystic dilations of the submucosal, where the ureter tends to enter into the bladder. We can see this little blub there. It's kind of a cystic thing. Ureteroceles are about 1 in every 5,000, so not real common. And this one actually favors female. So you see this more in girls than boys. It can be also associated with a duplicated ureter, so the ureter could split in 2 and come down in 2. One may enter into the ureterocele, one may enter into the bladder normally. Again, just as children, most of the stuff is done on ultrasound, so we can see there's that ureter. I like this as a cystogram, where they filled the bladder with contrast dye. And what we can see right here, this little nubbin right there, that's that ureterocele showing. All right. Posterior urethral valves. This one is confined to boys. We only see it in males. It can present usually on a prenatal ultrasound. It's associated with renal failure and bladder dysfunction. Again, these are all dangerous things down the line. Sometimes I think many of us have seen patients in their older years that have had a ureteral pelvic junction obstruction, didn't even know it, and they've actually, destroyed that kidney. Anyway, we can see right here that the urine is blocked at the urethral area. And again, on cystogram, this is best seen. So here's our bladder, and we kind of see this filling here of the posterior urethra due to this valve, this extra tissue that's there. Treatment, surgery. Simple as that. So again, it is serious. Pediatric surgeons earn their living on making sure they take care of these kids early, because otherwise they're going to be our future dialysis patients.